Now, processes for affordable healthcare in Nigeria are covered by a provision of the National Health Insurance Scheme Act 35 of 1999. Now, 19 years on, the reality of experiencing affordable healthcare remains elusive for most Nigerians. On the second part of the show, we take the conversation closer home to Nigeria, where we speak to the Commissioner for Health in Lagos, Jide Idris. In an exclusive chat with CNBC Africa's Christy, the Health Commissioner discusses digitisation and affordable healthcare in the country, brain drain across West Africa's health sector, proactive measures against the Ebola virus disease, among others.
Everybody is talking about health sector, how bad, how whatever it is. And issues like this bring up ideas and strategies to addressing the problem in the health sector. The future of healthcare, we need to look at healthcare, not from the perspective we need to look at it, look at what it should be. So if there are challenges, areas of challenges, I think gatherings like this help us with ideas how to resolve them. The essence is that there is a passion, there is a need to improve on our healthcare system, especially when we're moving to the 21st century and beyond.
Now, the first keynote speaker, Michael Jackson, did make some emphasis on trying to focus on the positives of the health sector in Nigeria. You are the man at the helm of affairs as far as Lagos State is concerned. Lagos is Nigeria's metropolitan city. Now, when you think and sit and consider the health situation, the healthcare system within Lagos State, for example, what bothers you the most?
What bothers me the most is that I believe we're not where we should be. And like Michael Jackson said, there's no point in looking in the past.
Rear mirror.
Let us look at the future. And luckily too, all the governments of Lagos that I've worked with have shown enough commitment, they've shown the vision. And in Lagos State, we are not benchmarking ourselves with any state. We are benchmarking our system with other countries, developed world. It's an enormous task. We think we have the commitment to go up to do it. Like I said again, we require the change, and that change is here. It should be done now, and we are also lucky in the sense that we need to leapfrog, and we can only leapfrog using technology, which is what all is said about today. The essence is that there's a need for change in the sector, and change involves everybody, every player in the sector: government, the people, the business, private sector, etc.
So now, looking forward, need for a change. That, of course, centers around transformation and leveraging on technology, which is the essence of the conversations that we have been having here. What steps would you say Lagos State, for example, has been making to ensure the transformation from analog medical system to leveraging on the digital?
I'll talk on the general level. The need to create a smart city for Lagos State. This is what government of Lagos State is doing. We're partnering with the government of Dubai into doing this. It's one way of bringing the people together, bringing commerce under using technology to improve development, to bring development to the state and improve the life of the people. With respect to the health sector, I'll look at it from different thematic areas. In terms of leadership and government has to imbibe that commitment to embrace technology to move the health sector forward. Once you have that, it means the vision will be created, and of course the wherewithal will be provided. 2, we need to partner with the people, especially those people who have the expertise in the private sector, especially those people with the technology companies, who have all these things that we require. Yes, we need to partner. When we're partnering, we have to create that precise atmosphere environment for them to operate, so that we can all achieve our objective. With respect to the infrastructure, the essence is to modernize all our facilities, starting from the primary healthcare level, the secondary level, and tertiary level. And when we are doing this again, we have to do it in context of what is happening right now in the world, and of course, again, bring technology to bear in service provision. And again, we're going to use technology to train the human resource people, and that is key, because the world is changing, technology is changing. All our health workforce must develop along the same line. And one of the ways to do this, again, use technology in training, like I did say, at the medical school level, the nursing school level, colleges of health technology, even the postgraduate level. And again, use technology again in the context of health promotion and disease prevention. And again, we're looking at take for instance disease surveillance. Collecting data now is faster for us if you use those technological devices to help us improve the technology. That way it's faster for us to collect this data, analyze them, and for us to be able to come up with some policies to drive our system. So it's very essential, it is key. And like I said again, if we look at the future of medicine, we're going to go into the age of genomic medicine. They call it personalized medicine. It's not far-fetched from the way people look at it. That's if we decide to not look back and look forward. A lot of things we are doing now, we can be aided, it can be fast-tracked using the platform of technology to achieve this.
Honorable Commissioner, even as we look to the future, talk about health, we cannot ignore the connection between poverty and health, especially in communities where most people have to pay out of pocket because health insurance is not prioritized. Can you talk us through at this point what steps, if there are any, that Lagos State is making to ensure that health insurance becomes utmost priority even at the basic level so that it is able to facilitate easier access for the common man?
The state government has taken this step to address your health insurance. It's going to be started this year. We have a law that has been enacted and passed to make it compulsory for all residents of Lagos. That law has made it mandatory that we use public providers and private providers to provide services. And of course, what is in the past that why private people are very, very skeptical about government is that who pays for the health? With the platform of insurance, there's a payment system now that we can use to pay those providers who see the patients that we allocate to them. That's one. Two, embedded in that again is your quality of care. Any provider, whether public or private, must meet some required standard in the context of quality because we need to provide quality of care. That is also one of the tenets of universal health care. And that's why we have the Health Facility Management Accreditation Agency. We are retooling that agency. We have our e-platform, electronic platform for registration. We have made our tools to assess all the facilities that are going to be engaged, that are going to be empaneled under this scheme. And lastly, we are engaging the HIAs, the health insurance agents, to assist us in the issue of enrollment, registration of people, collection of funds, etc. And again, all of these are linked up by a technology-driven system, an IT system, to make this things easier for us. It is a reality. And in the next couple of months, we shall roll out. We start the enrollment, we start the registration, and we're going to go all over the state now, telling people what to do, what not to do. We've decided on how much to pay. We're making it quite low because of poverty. And part of that law says that 1% of the consolidated revenue of the state will also go into that pool to actually take care of those people who are poor in the environment. That's what we used to pay for their own contribution. So everybody is going to contribute. If you're a resident of Lagos, it's a way of creating a large pool of funds to be to purchase healthcare for all the people of Lagos State.
Now, on a wider view now, when you look at it, the apparent lack of political will and brain drain are two key elements that may be cut across the health sector beyond Lagos, beyond Nigeria, across West Africa.
Yeah.
From your perspective, what strategies do you think are solutions to these problems that would keep our qualified health professionals within the system?
One, we have to increase our investment in the health sector. That's a must. Like everybody said, we are not investing, we're investing poorly. If we increase the investment in the health sector, we can be able to deal with our facilities, we're able to pay our health workforce. Now we can be able to set standards. That is, that's one. The second one is we must establish the rules of engagement between all the health workers, the different professional bodies. But when it comes to patient care, these are certain things we will take, these are certain things we will not take. But for as long as you create that environment for those people to be able to work, then you can lay down principles. With respect to the private sector, we're creating that enabling environment for them to because we have a dearth of health workforce. We have people outside of this country who are willing to come in with their private sector. So we will create that enabling environment for them to set up. So we can share responsibility. Government can face public health issues. We can pay primary health care issues. With regard to secondary care, tertiary care, the private sector is there to take care of that. Once we create that enabling environment, and of course, that's the essence of partnership. With respect to the people, you have to partner with them because You cannot have very good health sector, especially at the primary care level, if you don't have community engagement. The people must be engaged. And lastly, people look at primary health care as only facilities of people. The issue of water supply, power supply, sanitation, especially the environment are key. And that's why, again, government too must be to spend some money to address some of this, because all of this has positive impact on health.
As Ebola makes its way back into the continent, unfortunately, what steps are we taking to ensure that it does not make its way to Lagos?
We are happy everybody is sensitized. These are our past experience. So everybody is being proactive, even at the federal level and local, at the state level. We are partnering at the federal level to deal with the issue of our borders, people coming, bringing the infections. And again, at the same time, again, we are looking at building capacity, putting the structures in place, just in case you have it, maybe to contain it. And when you contain it again, you're able to detect. Once you detect, you're able to treat these people, isolate them, and those are something we're doing. Luckily, we have these systems in place. All we need to do is build upon them and raise the awareness of the people.
That was Lagos State Commissioner for Health, Jide Idris, speaking with CNBC Africa's Christy. That's a wrap on Beyond Markets for today. Thank you so much for being a part of it. Remember, you can watch all previous episodes of the show on our website at cnbcafrica.com. You can also stay engaged with the hashtag Beyond Markets, and you can follow my Twitter handle too at Esther Ubodaga. From myself and the team, thank you for watching, and bye for now.